Why is it crucial to comprehend medical terminology? Understanding these terms can be the key to unlocking the complex world of healthcare and, more specifically, disease management. So, without further ado, delve into a detailed exploration of some fundamental medical terms. First on the list is infection. An infection is the invasion and multiplication of microorganisms in body tissues, particularly those causing injury to host tissues. They can be caused by a variety of microorganisms, including bacteria, viruses, and fungi, and can range from mild to severe. Next up is disease. A disease is a particular abnormal condition that negatively affects the structure or function of all or part of an organism. It is often construed as a medical condition associated with specific symptoms and signs, not necessarily resulting from an infection, but could be due to environmental or genetic factors. The term infectious disease merges these two concepts. An infectious disease is a disease caused by an infection, that is, the presence and growth of pathogenic biological agents in an individual host organism. These diseases can be spread, directly or indirectly, from one person to another. Moving on to pathogen. A pathogen is a bacterium, virus, or other microorganism that can cause disease. These tiny organisms are often invisible to the naked eye, but they pack a punch when it comes to their impact on the human body. Next in line is pathogenicity. Pathogenicity refers to the ability of an organism, a pathogen, to produce an infectious disease in another organism. It's essentially a measure of a pathogen's destructive power. On a similar note, the term virulence comes into play. Virulence is the degree of pathogenicity within a group or species of parasites, as indicated by case fatality rates, the ability to invade the tissues of the host, and severity of the disease they elicit. Lastly, there is infectivity, which is the ability of a pathogen to establish an infection. More simply, it's how good a pathogen is at getting past the body's defenses and making someone sick. In summary, these terms are the building blocks of understanding more complex medical concepts. An infection is the invasion of body tissues by microorganisms. A disease is an abnormal condition that affects the body's functions. An infectious disease is a disease caused by an infection. A pathogen is a microorganism that can cause disease. Pathogenicity is the ability of a pathogen to produce a disease. Virulence is the degree of damage caused by a pathogen. And infectivity is the ability of a pathogen to establish an infection. By understanding these terms, anyone can gain a deeper understanding of how diseases function, how they spread, and most importantly, how they can be prevented and treated. It's a small step, but a vital one, towards a better comprehension of health and disease. With this knowledge, a more well-informed and therefore healthier life can be led.